Welcome to the Docs Who Lift podcast, where we distill and simplify the complexities of a healthy lifestyle, exercise, medicine, and weight loss. We're excited to bring you a podcast that's a prescription for clinical practice, scientific recommendations, and just real life. This is the Docs Who Lift podcast.
Hey, welcome back to the Docs Who Lift podcast. I'm your host, Dr. Spencer Nadolsky. I got my co-host. We're in the same square this time because I'm out visiting. We just watched the newly released South Park episode about the end of obesity, and we wanted to do a quick, timely, topical podcast on it. It just came out Friday, which was actually May 24th.
What day is it today?
It's a Monday. It's Memorial Day today. So quickly, we're doing this podcast. We just watched it, and we were going to just chat about it.
Hot takes.
Before, right when I saw it was just like a week or it was like a week. It was like a week, literally
the past couple of weeks when we heard about it.
10 days ago, maybe, that we saw the preview, the poster of it. It's hard to know what was going to occur in it, whether it's going to be extremely stigmatizing versus, like, a lot of people actually. I'm in a bunch of these Facebook groups where a lot of people using Wegovy, Ozempic, Mounjaro, Zepbound, and on Reddit as well. I kind of lurk in the background seeing what people are doing. And actually, a lot of the people that have obesity were excited to watch it. They thought that if anybody's going to do this right, it would be South Park.
Yeah, which I wasn't sure, just because, it's South Park. I mean, they're obviously pretty inappropriate, which sometimes we appreciate for sure. But they do tend to, make some interesting political points, or at least ethical points. And big picture is, there were some very interesting morals that I think kind of come from it, despite all the F-bombs and making fun of each other.
Yeah,
in bad ways.
Yeah, hot takes, basically. It starts with Cartman, and he goes to the doctor, and the doctor says, hey, there are new drugs out there.
Well, actually, I think it's more important to point out that Cartman, the character on South Park, who they have historically made fun of for having obesity.
Yeah, all the
kids,
time.
Right? So that's why we thought, well, maybe this would be a stigmatizing thing. However, I thought it was very important that they started off with him in the doctor's office with his mom, and the doctor talking not really just about his weight, but talking about his health. He said, hey, he's got high blood pressure, he's got dyslipidemia, which means he's got a really high increased risk of type 2 diabetes and heart disease and all this stuff in the future, and we need to do something about that. And that's when he introduced, we have these new really good medications for obesity.
Right. And then what comes of that is basically, he then does a dream sequence in his head where it's like, what would it like to finally be thin? And all the things he could say to other people, because then they wouldn't be able to make fun of him about his weight.
So he pointed out the fact that he's been stigmatized his whole life.
And so he wanted to finally zing people back, which was interesting.
Right, which is, it's a whole different thing. But it also kind of exposes sort of his internalized weight bias.
Right.
And in fact, the other kids ended up embracing it. I think.
Yeah. So then after what happened after that is basically the doctor wants to prescribe it, but then it's $1,200. They showcase
they have insurance, but it won't
pay
it.
for it. It only pays for the type 2 diabetes version.
Type 2 diabetes, which is Ozempic and Mounjaro, rather than Wegovy and Zepbound, technically.
And there are a lot of sequences going to insurances, going back to a specialist, getting a second opinion, and going through the prior authorization purpose.
Which they have a whole song about navigating our dysfunctional American healthcare system and kind of exposing the fact that the insurance companies and, big corporations and the hospital, and the doctors and patients are just trying to do the best they can. But our dysfunctional healthcare system, and I don't know enough to say, it's, just like people out there say, we're all bought and sold by big pharma. But there's obviously, I have an issue with big insurance, whatever big corporations have some sort of influence over everything. It's obviously bad. And yes, everything's 3 or 4 times more expensive here.
I guess we should note there are spoilers in this. If you haven't seen it and you want to stay away,
spoiler alert.
Go watch it if you're gonna before you listen to the rest of it. Unless you don't really care.
Some probably should have said spoiler alert before this.
Yeah, that's okay. That's okay. It's the beginning of that. That was basically the beginning of it. Okay, so spoiler alert. They do touch on those who are abusing the drug just for vanity weight loss purposes, right. And there's a lot that goes into that, and that's like half of the whole story of the 50-minute episode. Because
people should not be using these medications if they don't actually have disease of obesity. And, and we can even debate this today, is those who really should be prioritized in getting these therapies have more severe disease. So not just a BMI over 30, but also
which
higher
is what
BMIs.
The FDA labels
FDA,
it.
Yeah.
So.
But those with higher risk, like prediabetes, dyslipidemia, high blood pressure, fatty liver, or obviously type 2 diabetes, where they are, also approved and covered, but atherosclerotic disease, or just really, really high levels of adiposity, even if it's early on and you don't have those complications, where you have such a high risk of those complications. But instead, they kind of made fun of the sort of the Hollywood sort of use of these medications, where people don't have the disease of obesity. They don't need intensive therapy, but they're using it to lose 5-10 pounds for vanity purposes.
They even say the last 5, last 5 pounds. And this is what I fight with a lot of people on the internet about this is that the vanity weight loss. Now, because of that, and because of how in demand they are and how they're being abused by the Hollywood like vanity weight loss folks, they then and the pricing and the cost of it, they do touch on into compounding pharmacies, which then they're basically like, fine, we're going to get this and bring obesity medicine to the masses at a much cheaper rate.
But first, I think it's important to note they really highlight the healthcare disparities.
Yeah.
So they make a huge deal about, so the rich people who don't really need these medications are able to afford them and get them. But the people who don't have as much disposable income, but haven't, they're paying for their insurance, but the insurance companies won't cover these medications. They're the ones that really, really, really need them. That's a dramatic healthcare disparity. And they really highlight that, ultimately driving this sort of, and this is where we're really maybe debate, as you were starting to be convinced of otherwise, but the whole compounding deal where we don't know what the heck we're getting, to be honest. And so they get theirs from some factory in India, and everyone's making their own. It's like even my son asked if this was like Breaking Bad now. He says it's turning into Breaking Bad.
Yeah, so it was pretty funny. They touched on a lot of these things, but I mean, the compounding way of doing it is a lot cheaper and more affordable, and we can do a whole episode on that, because I actually have done a recently because we just did an episode on functional medicine and even talked about the compounding. I had to do a deep dive on research into this to kind of figure out, where are they getting the sources? Could it be done safely? Could it be done in a way where what you're getting into? We'll probably do a whole episode on that. Maybe get an expert on there.
Spencer starts to come around. He's a little bit more easily swayed than I am. I keep my skepticism at a pretty high standard. I'm not giving it to any patients.
I don't know. We'll see. I don't know. We'll see. We'll see what comes up of that.
You'll be the one to make millions from it if you do.
We'll see what comes of that episode.
And looking out for patients.
No, there's different levels of it, but this is what's interesting. They got it from India in the show, and it's it's possibly some of these same places that are that the supply chain is going to big pharma. You never know. We don't know. There's a lot of things going on.
There are a lot of complexities far beyond our comprehension that very unfortunate things that make it very hard on people.
They do highlight how big food is also trying to.
But I don't know how true that is. But it was funny and sure seems true.
Well, you see articles about how people aren't purchasing as much.
Yeah,
I don't know how true that is, because it's not as penetrated. It's becoming more popular, but only
affecting
a few percent are on these drugs in the entire nation. It's not a huge percent
for obesity.
Yeah,
for type 2 diabetes.
Though. Yeah, maybe a little bit
obesity
more.
complicated by type 2 diabetes. Really, most people with obesity and type 2 diabetes should be on these medications. But that gets into, again, cost effectiveness. That's a more severe state of obesity.
They get into body positivity as well, and how
as an alternative, which this is
but this
great.
is but yeah, it's actually
this is
you see this online. You see a lot of the body positivity folks. You'd be like, look, they shouldn't have any problems with these medicines. But what you see is that unfortunately, you see a false dichotomy with body positivity people saying obesity is not a disease and not an issue for
and
health.
not to worry about. So they go to the extreme,
right,
which is also not true and not safe. And yeah, you're right. So this episode really kind of did a good job of highlighting that, because sort of they make it obviously comical, like, oh, you can't afford it, I guess, you get this medication that helps you just be okay with that, and you don't care anymore, even though you might have significant disease that puts your health at really severe risk.
Yeah, if you're rich, you get Ozempic. If you're poor, you get body positivity, which they call Lizzo in the episode. So yeah, and then by the end though, like, I don't know, I think there were some actually really good messages. It's very vulgar, extremely vulgar. Which the thing is, like, it used to be on Comedy Central, and it wasn't until the movie came out to where they were actually dropping F-bombs. But like, when I watched it when I was in middle school on Comedy Central, they didn't throw F-bombs like that. They'd be vulgar, but in ways that weren't F-bombs. Basically R-rated. So that was kind of, whatever, to be expected, I suppose, although I didn't expect it at the time, because...
Well, yeah, he was having his toddlers watch it with us.
Well, my kids were in earshot since I was like, stop it. They got to get into a different room right now.
They already like some of their F-bombs. Anyway, so.
Yeah, they're throwing F-bombs regardless. But overall, I actually thought they did a good job at highlighting the disparities, the idea, the concept of obesity as a disease, the compounding thing, and the abuse for vanity purposes. They hit on a lot of the
so if you're able to sort of look through the vulgarity of South Park and be okay with that, and see it through that lens, and what bigger picture is it trying to communicate? Yeah, I think all the concepts, they're pretty morally on point, to be honest, that they were trying to get through to people.
Yeah, I was actually...
Good. Yeah, we were pleasantly surprised.
I've gotten messages from many patients and followers saying, hey, are you going to watch this? And I was like, yeah, I got to find time to do this and hopefully not allow my kids to hear it, although they heard some of it. And I was like,
they heard a lot of it. So my 12-year-old enjoyed it, but he's pretty he even understands the science a little bit of it, so I think he appreciates it. Well, and I think looking at Cartman, who again has always been this kid. He's a young kid in the show, and historically, yes, they've probably come around. I guess when we used to watch it, that was a significant problem. I mean, they always made fun of him, and I'm sure we didn't understand it at that time, and just everyone just thought it was funny. But if we really think about it, if you've listened to some of our episodes on the science of childhood obesity, he probably has a monogenic or syndromic obesity. If we took this and they made it reality, they actually really kind of got into it.
They got into it because they talk about his hyperphagia.
Yeah, he talks about how he never gets full, and then when he first took his dose, he still ate a lot, and everyone was kind of looking at him, and he said, "This is amazing. There's still food in this, left, and I don't feel like I need to eat it all." And it was the first time in his life that he felt full and satisfied.
Which is what most of our patients
people say.
Yeah.
So they really got it. They must have gotten some people who have real experience. I mean, I think kind of the Cartman lens was pretty powerful, because this, without the vulgarity, again, I don't want people to think, oh, we're promoting the vulgarity. I mean, we don't mind it, but some people might. But the Cartman perspective, I thought, was actually really powerful, and that a lot of times is how people feel. His internalized weight bias, his stigma, his feeling of never feeling full and normal, and thinking he'd never be able to be without obesity, basically.
They did it scientifically correct in terms of the names of the medicines too. Wegovy for obesity, Zepbound for obesity, Mounjaro and Ozempic for type 2 diabetes. That was interesting that they delineated those and made sure that they got that correct, which was Which and they also made fun of it too, because then the people using it for vanity weight loss purposes were like, "Oh, or which one are you on? Which one are you taking?"
They're all doing different ones because they're all the same types of medicines. They're just different FDA approvals and indications, and which leads to some of the coverage issues. But I guess the other thing we should probably tell people not to watch is if they don't like violence, because there was some significant violence in this episode. But that has to do with like big corporate food trying to block the availability of the medicines to help people, because they don't want to lose their money from people not eating their bad food anymore.
Yeah. I don't know if there's anything else. We were going to talk about the flow trial at some point. We don't need to do it right now. We'll do it on another
basically
episode.
That's just and I think we did talk about it before, but semaglutide at the doses
it got released.
It was released before, but now it was published in those with obesity, type 2 diabetes, and chronic kidney disease, because one, we always want to make sure these medications for any of these diseases are first of all safe, but then what benefits do they have? Now we've seen significant reductions in heart attacks and death, et cetera. And now we see that not only is it safe for the kidneys, which we pretty much already knew, but there does trend in a beneficial, statistically significant benefit.
Yeah, we can do a deep dive at some point, but it's very good to see that benefit as well.
And I think it does highlight that, again, going back to who should be prioritized in getting these medications. Certainly not the vanity people that were in the episode. Absolutely the people like Cartman who already are young and already have these complications. But then the people who have obesity, type 2 diabetes, heart disease, and kidney disease, they're going to get the most bang for the buck. Now, if these were just really, really, really readily available and cheap, probably anybody with even a little bit of risk of their obesity would get them. But that's just not the way it is right now. That's not reality.
I think in the future, what we're going to see is 10 years. It's not within the next couple of years. The demand is insane right now.
And the pipeline's really good.
But the pipeline's good. But I have patients driving hours and hours. I just tweeted this out, and then someone else responded like, there isn't any availability within 450 miles of this one. I don't know where they live.
We've been okay around here. I guess I shouldn't say where we live, otherwise people are going to start driving here.
Yeah, but I think in what we're going to see in 10 years, I think there's also going to be, if we can't change the food environment. I think we're going to start seeing, if you're at high risk of developing it, there might be people using it for preventive purposes. I don't even know. I'm not sure. We're going to see. I have a feeling it's probably cardioprotective as well, even in low doses in those who don't have a lot of weight to lose. I have a feeling. Got to be studied.
Again, that would have to be. It would have to be really cheap too, to be cost effective.
Got to be cheap.
We talked about in one of our last episodes where semaglutide itself, in someone with very sort of BMI of 36, I think was the person without a lot of complications, was not even close to being cost effective compared to that.
But it's cheap to make this stuff.
That's the thing. So if they make it cheap and very readily available,
it's very frustrating.
Preferably not from compounding pharmacies, from actual, it'll be, some will be generic soon. Liraglutide, which is Victoza and Saxenda. And I think even Exenatide's going to be generic soon.
I think they're going to make it still expensive, unfortunately. That's what I think. We're going to find out.
Yeah, we'll see.
And then when I come out with my own compounding pharmacy
I
will be in a lab coat with goggles.
Oh, God.
Testing it with the little vials and everybody.
I just want to make it clear that I do not endorse this effort.
We'll see. We're going to do an episode on it. We're going to do episode.
I'm open.
There are levels. It's kind of like levels of expertise in medicine. So like people can go, like anybody can go and get their obesity certification. They go to take some tests, but like just getting that doesn't actually make you an obesity expert. It does on paper, but like there are so many levels with that. And so it's the same
like that
thing.
Seinfeld episode when Kramer wanted to build levels in his apartment. It's like
levels. No. So when it comes to we're going to have a whole episode on this, but the levels of the I went down a rabbit hole because
you go down rabbit holes,
but I went down a deep one and I think it's interesting. So we'll save this for another time, but I think it might be possible to do it legitimately and safely if done in a certain way.
I promise it'll take a very high level of I have a very high high threshold to a standard to meet. So if you can convince me, I'll that's probably
I was
pretty
staunchly against it, but
we'll see.
I've come around to being.
But maybe
more
by
open.
the time you come around, the shortage will be done and it won't matter.
Yeah, it might be. That
Which
might
would
be,
be
which would be
great.
fine. So anyway, share this with someone who has watched the episode or someone that doesn't plan on watching it but wants to kind of know what it was about.
But spoiler alert.
But yeah, spoiler alerts. All right, here's our outro.
This podcast is for entertainment and education and information purposes only. Remember, the physicians on this podcast are not your physician. It should not be considered professional or personalized medical advice. It should not be used to replace speaking with your physician or medical professional to discuss your specific health concerns. The topics discussed should not be used solely to diagnose or treat any condition. As a result, we are not responsible for any unwanted medical outcomes. The views and opinions discussed are of those of the host only and do not represent those of any other entities.